Welcome, everyone. My name is Sierra Sanchez, webinar producer with CGLR. The webinar will begin shortly and will be recorded. Connect with the campaign for grade level reading on social media. On Facebook, like the page Campaign for GLR, and on Twitter, follow the account at Reading by Third. Please use hashtag Learning Tuesdays and tag us to tweet anything you learn from today's webinar, and we'll be sure to retweet. We encourage you to share your questions, reflections, and observations on social media. Once again, the webinar will begin shortly. It will be recorded and shared with you afterwards. Okay, hello again. My name is Sierra Sanchez, like I said. Before we get started, I have a few housekeeping details. First, we'd love for you to introduce yourself, so please use the chat box at the bottom of the screen to share your name, city or state, and your organization. Be sure when responding to select both panelists and attendees so that we all know who is here. The webinar is being recorded and live streamed on Facebook. A link to the recording, as well as any resources, slides, and bios shared during the conversation, will be sent in a follow-up email to all who registered. And lastly, we'll be posting a brief on-screen evaluation during closing and highly encourage you to respond. This helps us with our commitment to continuous improvement. I'd also like to turn your attention to GLR Week 2023, our save the date of July 17th through the 21st. Hopefully that's marked on your calendars, where we will be searching the theme of bright spots and silver linings. We'll be offering many plenary sessions as well as many state-led sessions, and we hope you can join us. And lastly, I want to turn your attention to our upcoming GLR Learning Tuesdays webinars. Next week on June 20th, we have an exciting doubleheader, starting with a funder-to-funder conversation on kindergarten as a sturdy bridge, place-based investments, and at 3 p.m. that same day, a session on strengthening kindergarten to improve children's pre-K through third grade experiences. On June 27th, we'll invite you to wrap up the month with us on a session on what it means to drive systems change in digital access with the Patterson Foundation, and a session at 3 p.m. on technology-assisted teaching and learning, continuing the conversation. Registration and more information for these sessions will be posted in the chat box now, and we hope you can join us. Joining you now is Becky Miles-Polka, Senior Consultant with the Campaign for Grade Level Reading. Thank you and enjoy the webinar.
Thank you, Sierra, and welcome everyone. We're so excited that you're here for this conversation today. As many of you know, you may have tuned in the past, we have brought the work of early relational health to our network a couple of times over the last few years. Most recently, I believe it was in January of 22. And we know that these early relationships between families, parents, and children are really critical for the development of little ones and to prepare them to be ready to enter school at kindergarten. But what we also know, and we heard from Dr. Linda Mays at our May 9th webinar, that parenting is also a developmental milestone for the adults in a child's life. And this is what this early relational health and nurture connection is all about. Nurture connection is focused on families and the meaning that this work holds for them. And so we are beyond thrilled to have leaders from Nurture Connection, including practitioners, folks who have been doing this work on the ground, funders, as well as those who have been really leading the work to bring parents to the forefront of this. So with that, I'm going to introduce our panel today that I'm so excited we have with us. First off is Claudia Aristi. She has been the director of Children of Bellevue's Reach Out and Read program and the HELP project since 2013. Her career at Bellevue Hospital began in 2000 as a bilingual parent educator in both programs. She serves on the board of Leyendo Juntos, a national Reach Out and Read initiative, as well as on the advisory board of Reach Out and Read of Greater New York. Next, Allison Logan has been and has a really interesting background. And you will have the full bios for everyone posted in the chat momentarily. Allison has been an embedded classroom coach and an early childhood manager at United Way in coastal Fairfax County in Connecticut. And in 2018, she became the executive director of Bridgeport Prospers and was able to help advance the impact of the Baby Bundle initiative throughout the city, including the advancement of developmental screening, expansion of Reach Out and Read, and increasing access to doula care. And Allison recently transitioned out of her role at Bridgeport and is now the CEO and founder of Logan Consulting and Company. And she continues to advance prenatal to 3 best practices, policies, and supports other communities with a focus on transformation of statewide prenatal to 3 systems. Dana Long, a longtime friend and partner of the campaign. Dr. Long has been a primary care pediatrician at the University of California, San Francisco, Benioff Children's Hospital in Oakland for over 20 years. And for the past 5 years or so, she has also served as the co-director of the Center for Child and Community Health. She has special interests in community health and engagement and in promoting equity in healthcare. In her practice, she loves supporting parents and caregivers, and her patients fill her with inspiration as possible, eliminating the inequities that lead to poor health outcomes for many families and young children. Next slide, please. Tish McInnes is the Alabama Strengthening Families Coordinator for the Alabama Partnership for Children, where she serves as the state lead promoting the Strengthening Families Initiative. She is a certified trainer by the National Alliance for the Children's Trust Fund, and she is also co-chair of the newly formed National Early Childhood Family Network. And Carly Roberts is the Associate Program Director for Out-of-School Learning at the Overdeck Family Foundation, where she manages the foundation's out-of-school portfolios and early impact and inspired minds, which focus on the areas of early childhood and informal STEM education. Carly has worked in education throughout her career, where she's coordinated comprehensive services for children and families in under-resourced neighborhoods in Washington, D.C., and has held consultative roles for school districts, Head Start Research, the Robin Hood Foundation, and the Newark Trust for Education. And last but not least is David Willis. Dr. Willis serves as a senior fellow at the Center for the Study of Social Policy, and he is a national expert in pediatrics, early childhood systems, and early relational health. At the center, he leads Nurture Connection, which is a social movement to advance early relational health at the growing intersection of child health transformation and resilient community building in partnerships with families and a social justice commitment. He is also the current co-chair of the National Academy of Sciences, Engineering, and Medicine's Forum on Children's Wellbeing. And all of our speakers today have much more on their bios, so I urge you to take a look at those. But we are so excited to get this conversation going. So David, I'm going to turn it over to you.
That's great, Becky. Hello, everybody. Happy Tuesday. And we're delighted as a team to be with you today to talk about our Nurture Connection, this movement about early relational health, and bring you an update. You know, all of us, all of you listening, care about children well-being. And we all know that many of our children, unfortunately, are struggling not only with post-COVID effects, but also family economic stresses, but also the youth and child mental health crisis. And then also that sense of disconnection and loneliness. And even last week, Surgeon General called out with his general advisory, the healing effects of social connection and community to address this epidemic of loneliness and isolation. And that's what makes this conversation today about the work that we're doing to advance this network movement about connecting emotional connections and relational experiences so vital and so important. Over the last few years, we have at CSSP created a coordinating hub to really create a network of leaders across all sectors to recognize and lean into the importance of strong, positive, and nurturing early parent-caregiver relationships because they're foundational to healthy growth, development, and that sense of parents' competence and connection for overall well-being of families, but also there for their children. And you may all recognize that in 2021, American Academy of Pediatrics put out a policy statement that called for a paradigm shift of clinical practices with partnership with families and communities to promote this relational health work. And that's what we've been working on over this last period. Now, in February, announced this movement that we're calling Nurture Connection. And that's what we're going to talk about today. It's a building of a network of engaged partnerships with parents, with families, with communities, and professionals across the sector. So today we hope to bring your awareness to this vital work. We're interested in you leaning in and learning with us along this journey, and then thinking in ways in which during the chat and the conversation we can have later about how do we think together about advancing this early relational health and this nurturing connection. So today, while on our panel, you're going to have a chance to hear from members of our Nurture Connection effort. And from clinical practice to parent experience and parent leadership and parent voice to what's happening in communities. So that's what our conversation will be today. So first, man, I turn Dana Long to you to talk about Nurture Connection and this early relational health work. Thanks.
Thank you so much, Dr. Willis, and thank you to the campaign for allowing us to share the work that we're doing on early relational health and nurture connection. As Becky had mentioned, I am a primary care pediatrician. I see patients and families, and I'm able to share space with them. I come to this work not only from that professional lens as a primary care physician working in a safety net, but also as the parent of 3 boys. And what resonates with me, what keeps me in this movement is the understanding that relationships are healing. And the beautiful thing, the power and the magic of relationships is the ability to have rupture and then to repair. It is constantly about being able to show up and to learn and to do better. And that's where I think the strength of Nurture Connection comes from. Next slide. I'm going to talk to you all about how Nurture Connection really became established. And a lot of it was because of the phenomenal leadership of Dr. Willis bringing together folks from so many different sectors. So I want to talk about what Nurture Connection is, how we are defining early relational health, and a little bit more about how we've created infrastructure and how we lift up family voice and equity in the ways that we move forward. Next slide. So about Nurture Connection, we are referring to ourselves as a national network that's committed to promoting early relational health. And by supporting strong, positive, and nurturing early relationships for every family, we can build healthier and more connected communities. Next slide. When we think of early relational health, what we think of, and this is a definition that we have run through our family care network, as well as multiple different stakeholders across geographies, is that we think of early relational health, that it is a state of emotional well-being that grows from positive emotional connections between young children and their caregivers when they experience strong relationships with each other. What we understand is that early relational health is vital for creating foundations of healthy development, lifelong health, and well-being. Next slide. Why does all this matter? And if you ask me, early relational health is literally at the heart of it all. Early relational health, it creates a necessary footing for young children to optimally learn and engage in the world around them. It helps children to cultivate relationships throughout their life. It lays the foundation for early brain development that helps to support learning and behaviors into adulthood. It's foundational early relationships that shape the well-being of both the child and the caregiver. And there's this dynamic, dyadic, two-way natured relationship about early relational health that affects both generations, and it creates health for every aspect of that dyad. Next slide. The mission and vision of Nurture Connection, it's pretty simple, right? Our mission is in partnership with families and communities. We are building a network and engaging in a movement to really lift up early relational health in every aspect of family and in every community. And our vision is that we envision a future where every family experiences the joy and benefits of strong, positive, nurturing relationships, where every community and all systems support the emotional connection between parents and caregivers and their babies and toddlers, and view early relational health as vital to creating a healthier society. I'm going to pause to tell you a really brief story. And last night, I have 3 children, one of my youngest, he's in 3rd grade. And last night I came home, and because of circumstances, our puppy was left out and destroyed my entire office. I got home and I was pretty upset. And so I said to my youngest, "You have to clean up after your puppy." And he was in tears. And I was like, "You cannot leave this room until it's picked up." And I realized as I walked away that his tears were not because he had to clean. His tears were because he had made himself a toy. He had made himself this toy out of construction paper and cardboard that he worked really hard on. And he had to clean up the pieces of this toy that he had worked on. And I was asking him to clean up the office, but really to clean up the dregs of the pieces of his toy that was really important to him. And when I realized that my understanding of his tears was misguided, I went up to him and I said, "I'm sorry this was so hard for you. I realized you were crying because your toy was destroyed. It wasn't because you were refusing to clean up. And that was my mistake. And I apologize." And then I know there's always chances to repair. And I said, "How about this weekend? Why don't we get some construction paper and some glue and some scissors, and we can make more of those toys?" So there's this moment in relational health where there's always this chance for both people to be the bigger, wiser, stronger parts of the relationship and to heal. And that's why I love early relational health. Next slide. So our values are to believe in a healthier future with thriving children. We believe in the power of connection. We value families. We value cultural wisdom. We stand for justice and equity. We champion communities, and we believe together we can create change. Next slide. Equity is in our mandate. It is the foundation of everything that we do. And we understand that equity means that we need to be anti-racist, we need to be pro people of color, and we need to talk about and dismantle structural inequities that lead to poor health outcomes. And so equity is the center of our focus as we think about early relational health. Next slide. So when we talk about equity, it really is embodied in early relational health, right? We celebrate strengths, we celebrate differences, we buffer against adversity. We're never going to be able to make all the bad things go away, but what we can do is change the way that we are reacting to them and really center ourselves on connection and family. We are fighting against unjust systems. We are advocating for policies that promote families and for practices that eradicate unjust outcomes in general. Next slide. So our structure is that we are part of a family network collaborative. We have parents in every aspect of the work that we do. We have a steering committee that's made up of people and places across the United States. And we have this national ERH network, this movement that is forming. And I'm going to refer everybody to our website at nurtureconnection.org to learn more about that network. Next slide. So our family partnerships, our work is guided by the folks that live in community that have real experiences. Even from the way that we are talking about early relational health to the decisions that our steering committee makes, we have families that are part of that work. We are working with the Family Network Collaborative, FRF, and FNC, and the FNC is one of the 3 leadership groups of Nurture Connection, and we have leaders and members of FNC on our steering committee. The FNC, it's a network. It's made up of 6 parent leaders from across the United States that really represent a diversity of communities, families, and children. And these parents engage with a network of 10 parents from within their local communities, bringing back the perspectives, insights, and recommendations from 66 parents across the United States. We believe in FRN. We want to lift up FRN. We want to scale FRN and their impact and the places in which they are working. Next slide. These are the members of our steering committee. As you can see, we are a beautiful, diverse group made up of health sector folks, policy folks, philanthropists, community organizers, families. Next slide. So our Nurture Connection work, it really is about creating meaningful and sustainable change. I want all of you all to learn more about how we are building connections, how we raise awareness, how we are creating understanding, transforming systems, and advancing policies that truly make sustained difference in the lives of families. Next slide. So we are building awareness through creating a communities of communities. We are developing and disseminating consistent narratives that message the importance of early relational health. We educate on early relational health about what it is and about how to promote it. And we message across sectors and across silos from within community. Next slide. We build understanding by bringing together learning communities that involve researchers from academic institutions like Columbia and UCSF to community engaged researchers and clinicians to parents as we are implementing and developing that research agenda. Next slide. So we are transforming systems, and we're transforming systems through individuals, through systems leaders, and through workforce development. And that's healthcare workforce development. It is parents. We are equipping and informing and energizing this movement to really advance early relational health. Next slide. Our policy work is some of the most critical work that we're doing. We not only want to do messaging, but we really want to make these changes when we think about policy in terms of how are we actually talking about family leave? How are we talking about healthcare? How are we talking about the early childhood sector, right? We want to be able to identify and promote policies on both the local level and the state level. So which states are getting it right, and how do we actually lift up those states so that states that might not have an agenda that promote children and families can really look to those states that are getting it right. Our policies focus on supporting strong, positive, and nurturing relationships and environments for young children in the context of cultural traditions and communities. Our policy team is really robust with leaders that have been working in Washington and locally on the ground in states so that we can have a comprehensive strategy in order to actually make the change that we want to see. Next slide. So thank you so much for listening. We are at the very beginning stages of the Nurture Connection journey. I can't wait to bring everybody into the fold and to answer questions. Thank you so much.
That's great, Dana. And if we can have the next slide. I'm really excited to share with you some of our members of our Family Network Collaborative to talk about the importance and that family voice and the learning from families as a part of our journey and development has been. So let me turn to Claudia. Do you want to begin?
Thank you, Dr. Willis. It's a real pleasure to be here, and I want to thank everybody for this opportunity to share this really exciting and important work. First, I come to this work really from many, many years of experience with Reach Out and Read, and I'm truly excited to see that there's a very large representation of Reach Out and Read folks in the audience today. And when Dr. David Willis invited me to participate in this work, it just seemed like a natural fit because through Reach Out and Read, I have seen the power. I have seen the magic that happens when caregivers connect with their babies and they are able to establish that positive emotional connection with their little ones, and how that then impacts the overall development of those children, not only in the early years, but in their adult lives as well. I've been here for 23 years and I'm seeing some of those children coming back and telling me they're in college, and it's really exciting to see that. And this Family Network Collaborative, the idea behind it, this was the first leadership group that was formed as part of the early relational health movement. And that to me spoke about how important it was to make sure that we were representing the parents' voices, the caregiver voices, because that's the heart of what we're trying to do. And we wanted to make sure also that we were learning from them, learning about their experiences, their expertise that they bring, because I think a lot of these parents and caregivers, the experience have been a top-down approach in which most of their interactions with the different systems have been in which they're told about what to do, what not to do, and that their experience might not be validated in the way that they should be, in the great wealth of knowledge that they bring. And I find myself learning so much from them on a every single day basis. And that was one of the ideas behind the Family Network Collaborative. And who we are is a group of 6 parents leaders, all representing sections and voices of parents who might not have been as well represented in the past before. So for example, here in New York, I represent the Spanish-speaking community who are immigrants. Tish, who is my partner in crime here, I'll let her tell you, but she is representing the parents in Alabama. We have another wonderful member representing fathers. And I noticed one of the comments in the chat was about how much you were enjoying seeing pictures of fathers. And yes, we need to make sure we're accounting for the father figures in everywhere, and just keeping diversity in general as the center and core of what we're doing here. We have also Mia, who represents the families with the brown and Black communities who have received services from home visiting services. And Alisa, who represents the family who have complex medical needs and children with special needs. And all of us have talked to a group of 10 families and caregivers and bring their expertise. So the other committees might have questions that they pose to us. And in the very beginning, one of the most exciting things that the process was, first, if we're talking about early relational health, we had to form the relationship among these group of parent leaders, right? So getting to know each other, getting to feel comfortable with each other, and knowing that this was a safe space for us to bring them the opinions and the ideas that our parents were sharing with us. And that was a fascinating process for us to also learn with each other and know that there might be times when we don't agree all the time in some of the areas, but that we can all come together and have important discussions about those topics. In my case, for example, with the families, also when the moderator for the whole Family Network Collaborator will pose a question that the research group had, we would turn to each other and say, what do they mean? How do we translate that to our parents in a way that makes sense so that we can have those meaningful conversations about these important topics? And we had to come up with living room language, right? Of saying, let's turn this question around and make it into simple terms, so that then we can have those discussions. Because if we were having a trouble processing the information, we wanted to make sure that most of the time wasn't just spent on trying to explain it to the parents, but really hearing about their ideas about what was the question at heart. So that was, for example, one of the experiences was really translating the questions and making it more accessible. In my case, double translation, because then I had to take it from the English to the Spanish. And as you might imagine, in Spanish, everything is 10 times more than in English. And using all these acronyms and all this simple, what seems simple in English, for you to translate it then into Spanish was really an interesting process that I have been learning a lot from. The other humbling moment for me was also realizing that after spending so many years working in a community that I felt I know because I feel I belong to that community. I'm Latina myself, I'm an immigrant, even though we all have different immigration experiences. I felt I know my parents really well. And I was really surprised to see some of the responses to the questions that we posed to them. So that was very humbling to me to see, oh, you're not even beginning just to learn. This is just the tip of the iceberg, which is wonderful, because sometimes we can get lost in the process thinking that because we've been doing this for so long, we have all the answers. But I want to make sure I pause and also allow Tish to share her experiences. And then I know we're going to have an opportunity to also answer some of the questions and have another discussion.
Thank you, Claudia. And thank you, Dr. Willis, for letting us share. As a part of the collaborative, one of the things that I've wanted to share and bring to the table is just an explanation of who we have. I represent Southern families, and in Alabama, we have a wonderful parent leadership network. We have grown from very little to quite a few, and we are located all over the state. I tell everybody we're north, south, east, west, and in between. So you can pretty much think of anything in Alabama, and we've got a parent cohort there. But some of those parents, just so that you'll kind of get a sense of who we have, we work with an awful lot of parents. We work with single moms and single dads. We work in families that have mom and dad both in it. We have parents of very young children, and we have grandparents who are raising their young children. We have pregnant teenagers that we're working with as they are about to step into the world of parenthood. We have a lot of individuals that we call kin. Yeah, that's a word to the South, our kin, our relationship caregivers that are taking care of children, and our adoptive parents that we have. So there's an awful lot of different types of families. And when we were invited to the early relational health table, we were thrilled. One of the things that we really try to do in our leadership training for our parents is make them involved in the community. And we try to give them training that is really relevant to raising their children, whether or not those children are tiny or whether or not those children are in school, or if for some reason they've got a different kind of situation at home. But to be able to sit at the table and do this early relational health work is so important. Everything that we do evolves around our parents. And just like Claudia had said, you know, we have 10 parents that we specifically go and ask our living room language questions to, but I have an awful lot of parents that know those 10 individuals, and they all want to answer the question and give me their opinion about things. And I try to listen to that. But some of the other things that really, I think, have brought a wonderful piece to the table is the fact that I have parents who want to be here. They're not forced to be by any means, but yet they are here because they want to learn more about how it is that they can help their children grow and to thrive in this time. During COVID, we were having a time where we would have our monthly meetings. And in the time of COVID, which I think speaks very highly to the ERH movement, but the parents actually came to me and said, can we meet weekly? We need to have this collaboration just amongst ourselves. We need each other to the point that we want to Zoom, and we want to Zoom weekly. And so we did that and started doing that and have continued. We call it Lunch and Learn in the summertime. We are about to kick off our Lunch and Learn, where they're actually going to have some wonderful opportunity to be taught some more of this early relational health piece. We do things. Last summer, we did the Growing Brain curriculum with them, and it was just wonderful to be able to bring that to the table for these parents to want to know how important it is and what they can do to connect with their children as young as they possibly can. And this work is allowing us to do that in a very unique way. So with that, we are looking forward to a summer of being able to learn and continue this work and just see what it is that we can do for our nurture connection work. So thank you, David.
And I just wanted to add one thing, that one of the things that was really touching for me also was to see how empowering this was for parents. In the beginning, they were surprised. You actually want to hear my opinion? Do they really care about what we have to say? And that for these parents and caregivers, for once to feel like someone is there actually seeing me, hearing me, paying attention and caring about what I can bring to the table, it has been really wonderful. And when they thought it was just me coming once to ask the question, but when they saw I would come back and again, they say, oh, you mean it, it's for real. You really want it, huh? And what are they doing? And they became really as thrilled as we were in the process of seeing how is this advancing? Where is this going? And that they were feeling part of the process of being able to add to the discussion that we were having. So that has been really, really amazing to see parents feeling validated in so many different ways and turning to each other and learning from each other. And actually, while asking a question, for example, a mom said, well, I just heard what she said, and I want to change my response because I've been thinking about what she said, and that makes sense to me. And then that has been also really amazing to see how it's not us, but it's really also parent to parent and caregiver to caregiver supporting each other in this process. And what Tish was saying about how early it can get, here, I know I can tell you at Bellevue, we start as early as the prenatal stage. And it's wonderful to see those parents realizing the power that they have, that by encouraging these families to start stimulating the baby during the uterus, talking, reading, singing, touching the belly. I had a mom who had a very difficult experience getting here to the States. And as she was getting ready to give birth to her baby, and we asked her about how has this information helped you, if it has helped you. And she said to me, well, it has helped me find joy during a very difficult situation. It has helped me be able to find a connection with a baby when I thought it was impossible because I was so stressed out about not having my husband with me and finding myself in a different country speaking a different language. And we just see it every day. And I think in that sense, Tish and I are very fortunate to be on the ground. And to us, early relational health is not just a concept. We see it, we feel it, we live it. And that truly is a blessing.
As you can hear, Claudia and Tish's contribution from the voices that they bring forward into all of our co-development, planning, organizing, and development really matters to the early relational health movement. This is a co-developed journey with families and communities. And our next presenter, Allison Logan, will tell you and share with you how all of this starts playing out at the level of community and on the ground. How the partnership with families, programs, communities over time is really starting to move this relational health movement into a place-based agenda and also a collective movement agenda. So Allison, can I turn to you, please?
Of course. Thank you, Dr. Willis, and thank you to the Campaign for Grade Level Reading to share this today. Really excited to share this work. So this work started in Bridgeport, Connecticut as a collective impact movement. So we were a Strive Together. Some of you probably know about Strive Together. We are a Strive Together collective impact movement, which was housed in the United Way of Coastal Fairfield County. Next slide. So a little bit about Bridgeport and a little bit of its context. Bridgeport is located within the richest county in America, Fairfield County, and many of Bridgeport's young children live with limited resources, families facing intergenerational trauma and structural racism. Data over many years revealed that among the Bridgeport children living in lower income families, more than 1 in 2 are not on target at age 3, and too many are not referred for help during these critical 1,000 days. And so out of the Strive Together Cradle to Career initiative of Bridgeport Prospers, which is what we were called, the Bridgeport Baby Bundle was born. And Bridgeport Prospers is collective impact. We are cradle to career. So that means we started prenatally, and it goes all the way up through employment and career. So we were looking across the spectrum, across the lifespan, and we had a coordinated community of partners that were working together across systems to really look at some data and really start from the pinpoint of data and really looking around how do we really create prosperity within the city of Bridgeport. And if you see the city of Bridgeport right there, it is surrounded by wealth. So all of the wealthiest communities in the United States and the highest achieving schools in the United States. And then right next to it is Bridgeport, literally 5 minutes away, with the lowest achievement scores in the state of Connecticut. Next slide. So how did prenatal to 3 become a focal point, and how did relational health become a focal point to the Bridgeport community? So we did our community action network, which was people ranging from healthcare, early education, home visiting. We started to collect some data, and the data that we collected was from 3-year-olds entering Head Start. There is no common measure in the state of Connecticut or in Bridgeport at the age of 3, so we used proxy measure data. So at the age of 3, for Head Start, 75% of the 3-year-olds entering Head Start did not reach age expected milestones. 21% of moms had no or inadequate prenatal care, and 63 of the city's 2,000 yearly births were Medicaid funded. So what we did is we did a huge landscape analysis. Where were the assets? What were the services in the community? What are the parents saying? We interviewed parents. We did focus groups with parents. We held baby showers and talked to parents in the community. What did they see? What did they want from this community? And we did a really large data and landscape analysis. And then we looked at the intersection of child development, neuroscience, and economics. And if you look at the intersection of those, it says to invest early. So if you know the Heckman curve at all, why are we investing early? Because we have the most impact. The earlier investment, the greater the return. And then the brain's ability to change in response to experiences. If you can look at that curve, between the first 3 years of life, has such an impact. And so our community of Bridgeport decided that prenatal to 3 was what our focus was going to be on, through a family lens, through a strengths-based perspective, and through an early relational health lens. Next slide. So what were our core community strategies of our prenatal to 3 framework? So this is a framework. So every community is different. We had to come up with what was best for the Bridgeport community. What were the parents saying? What were the services that were already there? And so we had a very large goal, is that all children in Bridgeport would be on track by the age of 3. And so we were looking at advancing healthy births, responsive services, supports for parents, and on-target development. And then these strategies, I'm going to group them into 3. So the first 3 focused on people. So universal supports and targeted services for primary caregivers. authentic family and community engagement, and this includes co-development and co-design with parents, parent and community advocates and ambassadors. Strategies 4 and 5 focused on the organizations that are part of the systems in the city. So trauma-informed, strength-based systems of care with trusted wellness navigators. I'm going to talk a little bit about this further. The lack of trust was just immense when we first started this work. And so we were looking at who were the trusted wellness navigators that can really work with families and navigate with families to really build that trust within the systems. And these include our doulas, these can include community health workers. And then we leaned in with our community health centers, and then promoting healthy organizations and relationships with a focus on equity and justice. And then strategy 6 and 7 focused on systems change. So we looked at data and how we're collecting data, what data do we have within the city, and then how can we hook up to the state level data, and then a broad base of funding strategies with an investment frame, because this needs to be sustainable. Once you build something, it needs to have a sustainable base of funding. And I'm proud to say that the Bridgeport Baby Bundle was a grade level reading campaign bright spot in 2017. So proud to say that, and you know, we've been working on it since then. Next slide. Here are some of the bundle work framework supports for their children. So we were really focused on universal supports because everybody needs some level of help. And this was a community campaign, a community effort, a community movement. So we have, which is launching this year, universal home visiting at both birthing hospitals. We have media tools called the Bridgeport Basics, which are framed off of the Boston Basics model that are spread all over the city of Bridgeport in pediatric offices, early care and education, the WIC offices, it's everywhere within the city. Developmental tracking and coaching. We have a Connecticut has a the first, and it's free for everybody in Connecticut, a Sparkler mobile app. So it's the ASQ on a mobile app and developmental tracking and coaching that's connected to our 211 child development info line. Early literacy supports, we have Read to Grow and Reach Out and Read. Read to Grow is at both fully functional at both birthing hospitals, and Reach Out and Read we have expanded to 98% of the pediatric practices in the city of Bridgeport. And then group time for parents and babies, music together classes that are happening all across the city. And as well as the universal supports, we also have targeted supports, wraparound wellness navigators, community health workers linked to the universal home visiting. The Connecticut Medicaid Maternity Bundle, which includes Medicaid reimbursement for doulas, will be launching in 2023. And right now, Bridgeport's incorporating doulas into the primary care practice. And then Bridgeport targeted home visiting programs. They were all separate and had their own kind of referral system, are now all linked together with one coordinated referral process through our 211 in Connecticut. And then of course, increasing infant, toddler, family, and center-based childcare. So those are all of the family supports that are part of our bundle. Next slide. So here's the, I'm not going to go through all of this, but the trajectory through the years, how we started. This will be useful for you later to look through our pathway and our framework for how we got this work started. We hosted community conversations. We had, we showed the resilience screening, really talked about ACEs and childhood trauma, and really building a strength-based community. We hosted community baby showers, collected lived experience data, and we started our universal campaigns across the city. 2018 and 19, we continued to build on those partnerships. Reach Out and Read expands to another healthcare center, and Read to Grow expands to both birthing hospitals. The Bridgeport Basics expands through the city. 2020-21 was a pivotal year. We received a 3-year funding from the Pritzker Children's Initiative for our Community Innovation Grant. So we were able to really grow. We had technical assistance, national technical assistance. We partnered with the Bridgeport Health Improvement Alliance to really move this work. And then 2022-23, we still continue to grow with ARPA funds to pay for universal home visiting, and then Medicaid reimbursement for the sustainability of that. We had a lot of policy progress, Medicaid maternity bundle, doulas for CT was a doula advocacy coalition that was built within the state. We have Medicaid paying for community health workers and doulas, and we had several things that have just passed legislation to create a doula certification process. So we have a lot of forward progress within since 2016 to 2023. Next slide. Where do we go next? So now how do we take our lessons learned in Bridgeport and go from Bridgeport and beyond? How do you take all the lessons learned, all the early relational health lessons learned, and really bring this to a statewide level and to other communities? So I transitioned out of my role and now as part of a consultant working with other communities across the state. Pritzker Children's Initiative will be funding the next 3 years of this work, and we launched a network called CT 359, which is Children Ready at 3, Children Ready at 5, and Children Ready at 9, connecting the prenatal to 3 space to ready for kindergarten to 3rd grade reading. So connecting those through this network. And we are working with community health workers across the state and helped with 9 HRSA applications to take some of the elements of the bundle, like community health worker support, like Sparkler, like Reach Out and Read, like Read to Grow, and really looking at expanding those across other communities in Connecticut. Next slide. So how do we use the best practices of the Bridgeport Baby Bundle to scale in other communities and drive state level early relational health systems? So we're going to be focusing on pregnancy and the birth experience. We're going to be focusing on child and adult relational health. We'll be working with Dr. David Willis and the Center for Social Policy to bring Nurture Connection movement to Connecticut, and really support universal light touch natural supports through the Baby Bundle portfolio with Sparkler, the basics, and early literacy supports. And also a focus on positive parent pediatrician partnerships, child developmental screening, referrals and services, family-centered strength-based relational health approaches. Next slide. So what will we do next? We have a Circle of Friends and Pediatric Developmental Screening Practice Work Group. Our Circle of Friends will be looking at, made of 24 organizations, where we'll highlight the analysis of Medicaid data across 22 Connecticut communities, really looking at increasing developmental screening and referral, and how parents are involved in that process, and how parents are building the relational health between parent and child, and how they're involved in their child's development. Expand engagement with HRSA and community health centers across the state. Next slide. Expanding engagement with cross-community sites. We have 4 other Strive Together communities in the state of Connecticut, working closely with them and working closely with communities that are receiving the HRSA grants. And then also continuing to move on community health workers and doulas included in the primary care team within these pediatric practices. And then really doing some shared communication and broad outreach in the state of Connecticut and across our city sites on early relational health and the use of these Baby Bundle strategies to really build upon that. Next slide. And then looking to the future, there's some opportunities. So there's some national measurement opportunities. At the beginning of my presentation, I said there are no developmental milestone trackers at the age of 3 that are universal. So we're looking at some population level measures, such as the EDI and then the NSCH, and really looking, there's a new measure that's coming from the University of Nebraska that is piloting a new birth to 5 measure that incorporates this, the GSED and items from the HRSA supported healthy and ready to learn national outcome measures. It examines multiple aspects of children and family development, which for the first time generates population level estimates of child development. And so we're working with some national level folks to really think about how we bring those to Connecticut as well. Next slide. And that's it for me. There's my information. And I also work with Dr. Janice Grindell really closely. And if you want to reach out, but we will have more to talk about during the Q&A. So thank you. And I appreciate the time today.
Allison, that's phenomenal. As always, I'm inspired by the multiple levels of engagement, as what we call an all-in strategy for all systems, both formal and informal, surrounding young families in a relational health frame in all ways, and then looking at building well-being over time and started to measure at a population level change. It's so inspiring. And there's so many other communities that are leaning into this kind of possibility and growing forth. So, but let's shift a bit to a funder perspective. And we've asked Carly Roberts from Overdeck to share with us some of her thoughts about and comments and reactions to what you've been hearing here.
Thanks so much. It's wonderful to be here with all of you, and I just really appreciate presentations and the wonderful work that you all are doing. So I will add some quick comments just to really emphasize what was shared today. By way of brief introduction, Overdeck Family Foundation aims to measurably enhance education, both inside and outside the classroom. And we know that education is not just cognitive learning and addition and subtraction and literacy. It's so much more, and especially when children are young, we know that they need the best possible start and that they need to enter school with the tools they need to succeed. So in our early childhood focused grant making, we really aim to ensure that children experience high quality early learning environments, home and away, through relationships with caring adults who can support their development. We believe that promoting early relational health and supportive adult-child relationships is really central for this work, and it is for many of the programs that we fund. And as Dr. Long put it so beautifully, it is the necessary footing for young children to optimally learn and develop and engage in the world around them. So many of the folks on the call here are representing communities, and I want to bring and put a finer point on some of the evidence-based programs that were mentioned today that really support those caring adults around young children to understand the importance of these early nurturing relationships. Reach Out and Read, of course, is a wonderful example, and Allison's comments highlighted how many of these programs can come together with best practices and with other universal and targeted supports to create that all-in approach.
Carly, could I interrupt for just a second? There's an echo that you have. Do you have two microphones going?
I don't think so, but I will see what I can do. Is this better?
Keep talking.
Okay, let me know if
Much better. That sounds better to me. Thank you.
Thank you. Sorry about that. So just, lifting up some of the examples that were shared with this group. We heard Reach Out and Read, we heard other programs, and there are others that weren't mentioned today, like Lena, like Fluency's, Parent Corps, so many programs that are really working to build those relationships and meaningful interactions consistently for young children and the adults around them. And then localized examples of really putting ERH into action, as you said, Dr. Willis. Across all those presentations, I really hope you heard loud and clear the importance of meaningfully co-developing and partnering with families and communities in this work, intentionally building trust, using living room language, I also love that term, and really deeply listening to families to understand what this means to them. There's so many ways to do this that are adaptable to your own unique community context. And I encourage you to consider ways you can bring these concepts to life in your own work and to join us in this Nurture Connection movement. So with that, I'll turn it back to you, Dr. Willis. And
that's great, Carly. Thanks so much. And we can have all of our panelists come on screen. That will be fabulous. And we can start to have a bit of a discussion. I'll start off with the first question, but we welcome, for all of you listening in, any questions or comments that you want to put in the chat or in the Q&A so that we can respond. But one of my first questions is to all of you, and I'm eager to have each of you respond, and that is, this Tuesday gathering is an audience of community leaders and funders who are committed to working locally to improve early learning, third grade reading, all knowing that the foundations of early learning start early. And I wonder if each of you might comment about how early relational health and nurture connection are linked from your views to this early learning movement. So who wants to start?
I'll be glad to.
Oh,
Whoops.
Go ahead.
Go ahead, Allison.
Well, I think I think it's because the bundle has so many pieces to it, and the early relational health seems like an umbrella that encompasses so much in early childhood. You know, it encompasses, you know, infant mental health, early brain development, you know, early childhood development, adverse childhood experiences, healthy outcomes, positive experiences, strengthening families, all of those things that seemed separate before. Like it feels like it's all coming together under one umbrella, and I think, you know, I think that's what's so exciting about this. And I often feel like there's a disconnect between like early care and education and child and family emotional and relational health. And I feel like this focus really brings it all together under one umbrella, where this could be relative in the early care and education space, right? Just as relative as it is within the you know, within the family and child development space. And so and it puts the child and family needs in the forefront, which is what the most amazing piece of this is. And it does bridge the gap between home and child and family and home, and then early care and education. So the umbrella really bridges that gap.
And that's that sort of paradigm shift, isn't it?
Mhm.
Where it's an all-in strategy where we're all talking about nurturing connection, being connected, countering isolation, countering loneliness, and being very intentional, which is very strong. Who else wants to lean in?
Well, I think I'm going to piggyback on that from what Allison has said, because I was going to share for parents, a lot of the work that, you know, we do in trying to teach them the importance of moving a little bit of knowledge goes a long way. And where parents, people didn't think parents really understood all that they needed to understand. And whenever we're able to go in and say, hey, here is this movement of early relational health. So everything that you were thinking that you were doing with your children is probably correct. And giving them the substance for being able to say, I'm learning and I am smart, and, you know, I can advocate on behalf of my family. So that's the biggest piece. And also can't forget about our early child care caregivers, because they too are working so hard behind the scenes to help our families to have that knowledge of what they're trying to teach their children, and teaching it basically to their parents as well. So that's what I love about this movement.
Who else wants to comment about early learning and early relational health?
It's also being able to help parents see how what they do right here, right now, has such a long-term impact, right? That we don't have to wait until the children are getting ready to learn to go to school. They start learning right at home with you, because they learn best from the people who love them the most. And who are the people who love them the most? Is those caregivers in their lives. That there's no human being who can learn really effectively when it's not in a context of love and feeling safe and secure. And I think when families realize that is those, you don't have to spend all day there, but, you know, having those the present moments, those really moments of connection, the positive connection. And I'm thinking, for example, of a baby. I was talking to a family in the clinic, and I was saying hi to mom, and I was saying hi to the baby. Mom wanted the baby to turn and look at me. And I was telling mom, and the baby was just fascinated with mom, of course, because the baby was in love with mom. Who else? And mom kept trying to tell the baby, look at Claudia, look at Claudia. And I said, Mom, that baby is telling me everything I need to know. That baby is growing up with a lot of love and care, and look at the connection he has with you. That's why he won't move his eyes away from you, and I'm okay with that. So great job. So while she was feeling that, oh no, the baby's not paying attention to her, this is disrespectful in her mind, it was disrespectful. I was pointing to her, actually, this is perfect. What I'm seeing makes me really happy.
We've been talking a lot in most sectors now about the relationship is what really matters. And the support of the relationship struggle and patterns rather, and supports, and the beauty that we can see that all parents can experience with their babies and young children, and how do we support that and be visible to it? Who else wants to lean in around early learning and early relational health?
I do, David. And so, Claudia, I love listening to you, and I love that you just brought in this perspective about how you were in clinic in an exam room with a mom and witnessing early relational health sort of happening in real time. And it also relates to what Allison had mentioned about adverse childhood experiences and screening and education around adversity. The question is really focused on early education, but I have to say that this movement is so refreshing for us as pediatricians and clinicians working with young families, because what often happens is that we are sort of being mandated and encouraged to screen for things like ACEs or autism, child development. And the struggle is, well, then how do I, as a healthcare provider, how do I respond? Right? That's always the struggle, and where providers are seeing the gap. And I think that's the space that early relational health occupies, because the response, the treatment, the intervention, the healing comes in connections, and it comes in relationships, and it comes in being in the room and being able to share simple statements like, you are a good parent. Look how in love your baby is with you. Look how he can't take his eyes on you, that you are the buffer that your child needs. And so it provides the solution that oftentimes is what paralyzes us as providers from diving in deep to the adversity, right? It is the healing that we need.
That's so phenomenal, Dana. And the child health system in all of its different clinic forms is a platform of partnering with families. We've got a lot of work to do, but partnering with families, with communities, and building those trusted, nurturing relationships with providers becomes really important. One of the questions that's come up is, how do we begin to tell communities about how to get started with engaging their medical communities or their public health partners? How do we begin to do that in local communities? What guidance would you give? Allison, can I come to you first, and then to the rest of our team?
I have a very specific way how we got started, because when we started this work, we all came together like, what do? We have so many partners that I didn't even know yet. And so it was all about relationship building. And we had one pediatric champion in one healthcare center that was already doing reach out and read. He was doing ACE screenings, but then he had like family groups that worked on relational health, and he was doing all of these things within the federal qualified health center. And he loved the basics. He wanted to do that. So we took him, and really he was our champion throughout the city. He got us hooked up with the hospitals. He got us hooked up. The Connecticut Academy of Pediatrics, we were speaking at that. We spoke at Grand Rounds. I mean, he got us connected because he was already doing this work and believed in it so passionately that all of a sudden it started to grow. And then he pulled in the other healthcare center, and he pulled in the birthing hospitals, and and through that we were able to build huge relationship and trust, because this was a community-led movement. Right. And so having the healthcare system trust this movement, having him saying, you can trust these folks, they're going to do well. And they're going to really build that trust within your healthcare center and the community, because we brought community messengers on the development team for this. We paid them as consultants, and we had to integrate them within the decision making in the healthcare system. So it was, a trust on both ends. So I think having a champion and having somebody really willing to do this work and really build your reputation with a system that sometimes might not, might be in their own siloed bubble, I guess is what I'm trying to say.
Phenomenal. Who else wants to lean in about linking, engaging the health sector or the public health sector?
So I'm going to add to that, Allison, and most pediatric offices have a reach out and read champion or have heard of reach out and read. And I think that going through reach out and read to talk about early relational health is a very doable way to engage the health sector in the work on early relational health. Nikki Sullivan is the new executive director of Reach Out and Read, and is really trying to expand Reach Out and Read to be beyond the book, and much more about relationships. Those of us that are primary care pediatricians, we often are blocked by our own walls of the exam room, but we want to be in community. We actually want people to reach out to us. It is so hard to have a 3 or 4-year-old that you are concerned about their development and there to be no communication with the preschool or the child care center. And so I think that the plea from someone who's inside of healthcare is please find a way to reach out to us, right? Come to clinic and see us, email us. Like, we want to be able to do what's best for our families. And the hardest thing is having like a family fill out an ASQ to know that that child is in like the at-risk or almost at-risk range, and not to be able to network with those people that are interacting with that child.
So Tish or Claudia, you want to lean in?
Yeah, I want to share something that we're going to be doing this summer that, in a way, yes, it will certainly do. Our Alabama Department of Mental Health has reached out to the Alabama Parent Leadership Network. We are going to partner this summer with creating a resource packet for those pediatric offices that are connected to their project paths, and that's the pediatric telemental mental health services, these pediatric offices that are connected to Project Path. And we're actually in the process of training our parent leaders that with a packet of resources that they will be visiting pediatric offices and going in, I think, as a different way to just present some wonderful information to those offices. It will carry, of course, David, we're trying to think about our ERH movement and how that can be included in that. We have a wonderful parent handbook that we share. We have Help Me Grow and the Infant Early Childhood Mental Health group within our office. And so those resources will be shared. And of course, Reach Out and Read as we distribute our developmental milestone books in this packet. So I'm excited about this opportunity, and we'll certainly share back with you on how it works.
That's phenomenal. I had alluded at the start of this webinar about the AAP statement about the paradigm shift in primary care practices, partnering with communities and families about promoting relational health. And pediatricians are listening everywhere. And they know they want to be further connected with communities. And thereby each one of you in your communities have a chance to find your champions, because they are listening too and wanting to find ways to be more linked and connected, just like we're hearing from Tish and across many other communities doing similar kind of efforts. Carly or Claudia, anything you want to add?
Sure. Two things. One is that definitely Reach Out and Read at the national level has taken an interest and is a strong partner in this movement, and has updated their national training for all of the providers to include early relational health. So this is definitely a commitment to make sure that all of our medical providers understand and have also the right messaging to share with family, because sometimes it's theory right here in the head, right? But then how do you find the words to transmit this important language? And the other thing is for all of us to realize this is a public health issue. A very, very important public health issue, and helping everybody in the public health arena notice that by paying attention to this, because we talk about, right, we were saying ACEs, and we talk about being worried about children falling behind and having developmental delays and other factors that affect their development. And while we don't have control of every single factor, this is one. Why don't we pay attention right to the positive childhood experiences that we know make such a huge difference, and put our energy into that early, that hopefully later on means that we're not spending so much time and energy and worrying about if our children are going to be okay later on, but that we know we're empowering these families to connect with the children at the level that we know makes such a huge difference. And it's a win-win situation for all.
That's great. I see a question in the chat that I'd like some of you to respond to. Could you discuss how you are able to move from targeted to universal and how wraparound services and navigators interrelate?
I'll take that one, how we did it. So we actually started with the universal. When we did this, we're like, what are those universal approaches that everybody needs within the city? The targeted, we had to really look at what was already there and where the holes in the targeted services were. So that's what our year-long landscape analysis did. We started with the campaign part. So we started with the Bridgeport basics, and we started with looking at who had Reach Out and Read, and we started looking at those kind of sparkler and those universal supports. So we started with the universal and then looked at the targeted supports that were there. Where there was something missing, there was a huge piece missing at the hospital level. So there was nothing. Once a mom had a baby, that was it. There was a hole unless they were referred to a targeted service. So that's when we pulled in Family Connects and we pulled in universal home visiting. And then our navigators are actually are embedded within the federally qualified health centers. So they're meeting with mom early. They're connecting with doulas, are connecting with moms early at their prenatal visits. Community health workers are connecting with moms early at their prenatal visits and really build, what do you need? Do you need food, housing? What are the supports that you need? Really build, looking at the social determinants of health and really navigating the system for themselves and their child and working with their pediatrician. And so we're making sure that we're building trust with doulas, community health workers early to be able to navigate. Do you know about Sparkler? Do you know about, these other services that are offered? And then how can the community health worker and doula work together with a family to really build the family strengths?
I think these questions were actually, they were as if they were written for me to answer around the technology and the community health worker and the navigation space. And so if I can just take a minute to talk about, for the last decade, we've been using full-time community health workers who come from the community, who have access to the same services that our community members have access, who speak the same language, to be full-time in clinic in our federally qualified health center with us, co-seeing patients. So how do we go from universal to targeted? So our navigators are known to our clinic. Our patients get to our navigators in many ways. It could be the provider that is referring to the navigator because there's food insecurity or housing instability or need for diapers or green space access or childcare. It could be that the navigators themselves reach out directly to the families, or that the families can self-refer to our navigators. Those services are offered to every single family that walks through the door. As many of you know, I'm happy to share that we are launching the first ever racially concordant pediatric clinic for early childhood in July. And in that clinic, we're focused on self-identified Black families with Black providers and community health workers working together. And so that's more of a targeted clinic where every single family will be asked if there are unmet needs that the navigators can help to address. As for technology, we did build a platform. I put a link in. It's called Find Connect, and it's an innovative cloud-based system. The app should be out and publicly available on the Apple Store within the next month or so, so that families can actually work with navigators to find resources that are culturally specific, relevant, that meet families' needs, and that we can create action plans with families and then close the loop with families to make sure that the need was resolved. That Find Connect platform is available to anyone. If anyone's interested in using it, let me know, but it's really been essential for us to do resource navigation in ways that are culturally humble and specific.
Right. I want to go back to the universal question. Nurture Connection is a universal messaging strategy and universal for all children and communities and families. and countering sort of the cultural myth of independence and the vulnerability that we're seeing everywhere of loneliness. The numbers about loneliness of young families are staggering. And that means, and that's not good for young children's development, right? And if you look at the staggering numbers of loneliness that our youth have and ask the connecting point to that and the mental health crisis we have in front of us, calls out a really significant paradigm shift for everyone. Hence why it's so cool that the Bridgeport work is really an all-in strategy for everybody hearing relationships matter, connection matters, countering isolation at every level, starting prenatally and forward. And so I'm wondering if any others want to comment, in this moment of our youth mental health crisis, the Surgeon General's call about countering isolation by connection. How do you all think about this early relational health nurture connection movement responding to what you're witnessing, what you're seeing, what you're hearing from families and communities? Who wants to lean in?
David, I think right off the bat, and when I saw that question and which was trying to think of the loneliness and isolation, I have to lean in and think about some of our pregnant teenagers and the fact that we are working with them specific. We're also pulling in the lead caregiver of the house in which they're living in, whether that's a mama or a grandmother or an adult friend. But yes, everything is relationship. And if we can just keep building on that and help parents to understand what role model they need to exhibit. If you've got a withdrawn and an isolated parent, then chances are even greater you're going to have a child that is that way. But if they can reach out of whatever circumstance that they're in that puts them into that isolation and realize that they've got to stand up and be something different for their family, I really see that as being something that can help. And if we can help parents come out of this social isolation, and unfortunately, it was just hindered even more so through COVID. But we've got to be able to build that strength back into a family of being able to reach out and grab a hold of your neighbor in a good way.
As well as neighbors reaching into that young family next door or around the block that are struggling. The connecting really, really matters. Other reactions, thoughts on the team?
I had a personal example. So when we started doing this work, one of the first pieces we did was roll out music together classes throughout the city. And we had them in our healthcare centers and stuff. And I remember, actually, I'm a music together teacher as well. So I was part of the work and sitting with the moms and sitting with the grandmas and the families. And those classes every week grew and grew and grew, and we had to get another teacher and grew. And one of the things I heard the most is that this is the only time that I'm sitting with somebody like another mom, I'm connecting with another mom who has the same issues as me, who has it's the only time I'm getting to connect with other moms and with other children. And so I think things like, group prenatal care and things like, music together classes and things like that really break families of that social isolation. And I think we're actually going to be starting a music together class at Bridgeport Hospital and one of the healthcare clinics. So those are the types of things, if you can incorporate that within where families go and have it be part of the everyday practice, I think it is their connection to other moms within the community.
That's phenomenal. If I could lean in as we're coming around towards soon concluding, what has surprised you most in this movement building effort? What would each of you say that has surprised you? And there's a poll. If you don't mind filling it out, that'd be great. As each of you have a chance to comment about what has surprised you.
Jump in, from the funder perspective, obviously, we're supporting families who are facing all types of adversity, and recognizing that adversity adds to the challenges that come from this lack of connection, that it's not limited to some families. It's not for those families. It really is so universal, the need for connection. And as you pointed out, David, this is a real epidemic of loneliness. And that was surprising to me. I hadn't really thought about it that way before.
Thanks, Carly. Who else? What surprises you?
I think for me, what surprised me was the amount of time it takes, first of all, to build these relationships and the amount of time it really takes to do a really coordinated effort like this. And the second thing is that, when people, we're all common friends here and we all come from a strengths-based perspective, but how many people within the systems actually come from a deficit perspective? And I think having to do that paradigm shift, because the first thing we did is in our landscape analysis say, here are all the assets that Bridgeport has. The churches, here are the assets. And we actually rolled out Bridgeport Basics and stuff within our churches, right? Like, what are the assets instead of looking at it from a deficit perspective? And I think it was surprising to me how much it was a deficit perspective when we started this work, and then how it actually switched to this, asset perspective, strength-based perspective as we move forward in the work.
Allison, that makes me think about the abundance movement. Yep. Relationships are an abundance opportunity. They're everywhere if we're intentional, not only what we can share out, but what others can share with. And so it's part of that abundance view rather than a deficit view. Thank you. What else has surprised you out there?
I want to say, I'm sorry, Dana, go ahead.
No, I like you first. Absolutely.
One of our things that surprises me most is that honestly and truly, that I have parents that want to be at the table. They want to be included. They love that their voice is being heard, and that I feed back that, yes, we heard what they had to say.
Right. And I think you wanted to lean in.
I did. One of the hardest parts of the learning that has surprised me is how challenging it can be to be willing to absolutely listen, and then being willing to make pivots and to go back to the drawing board, right? When you are incorporating community, you will hear what resonates and what doesn't. And it is sometimes you get so attached to a notion and someone will say, absolutely, this is going the wrong direction. And then being willing to step back and say, all right, let's shift 90 degrees. And when you do that, the results are always so much better, but it's a humbling process to listen.
And we're all learning, aren't we? We're all learning. We have about 3 to 4 more minutes. I'd like each one of you to take less than 60 seconds to give me your final comment. And let's start. Allison, can you give me your thought? And then I'll come next to Tish.
Sure. And I was thinking about what to say here, because I say something all the time, and it's like my motto is that progress moves at the speed of relationships. So it doesn't matter what kind of relationships that you're talking about, whether it's within a family, within systems, that it's all about relationships. So that's why I appreciate this work so much.
Tish, then Claudia.
Less than 60 seconds. Thank you so much for letting me be at the table today and to share some of the things that we have that's going on. And yes, I would like to just piggyback on Allison again. It is all about a relationship. And thank you for bringing that to the front of everything that we do.
Claudia, then to Dana.
So what I would say is relationships matter. Connections of moments matter, and they do take work and time, as Dana was saying. But the opposite of that, I don't even want to think about it. I don't want to think about the prospect of not investing our time, energy into promoting this for all families.
And Dana to Carly.
I think the word that comes to mind is delight. We need to make sure that we are delighting in each other in our environment every day.
And Carly.
Delight. I love that. Relationships are just so important. And I think that is kind of a no-brainer when you think about it in your own life, but they're important in and of themselves, and they're connected to pretty much any other goal you have in your work when you're doing work for young children on behalf of young children and families. Invest in relationships.
That's great. And I'll close out. One, thanks to the panelists, each of you for your time with us. Thanks for all of you that have attended today. Thanks especially to the campaign for inviting us. And then my last comment is join the relational movement, the Nurture Connection movement. Sign up and spread the word because this is really a social movement for all of us. It matters for the next generation. So can I now turn to Becky? Can I turn to you?
Yes, David, thank you so much. Thanks to all of you, Claudia, Dana, Allison, Tish, and Carly. Thank you so much for your time and for your thoughtful contributions to today's conversation. And David, thank you so very much for pulling together this wonderful panel of your friends and colleagues to share this work. It's been a joy and an inspiration to follow the early work of early relational health, now to Nurture Connection. And we'll keep spamming you, join up, join Nurture Connection, because there's so much more that you can get from being part of it. So here you'll see on the slide some of our upcoming webinars. We hope that you register and join us for some of those. And GLR week, we'll have some grade level reading week. We'll have some great conversations all week long. So hope that you can join us for those as well. Thank you all. Thanks everyone for being here today. And we'll see you very soon.